Okay, so my name is Egan Oliver, and this is my psychological evaluation of Lolly Whitehill off of Orange is the New Black. So for the first part, Lolly Whitehill is a former inmate at Litchfield Penitentiary and a former inmate at MDC Chicago, with an interest in conspiracy theories. Her heritage is Norwegian and her religion is with the Evangelical Lutheran Church. Her symptoms are mental health condition that causes her to experience auditory hallucinations such as voices, delusions, disorganized speech, disorganization, catatonic behavior, The disorder Lolly suffers from is schizophrenia, which is a mental condition where she sees and hears things that are not there and believes things that aren't true. She also suffers from anxiety and depression. Best treatment plan for schizophrenia: a medication that is taken orally every 3 months to help keep the patient calm. An individual psychotherapy, self-help groups, social skills training, psychosocial therapy, cognitive behavior therapy. For depression, best treatment plan: 3 of the most commonly used methods in depression treatment include cognitive behavioral therapy, interpersonal therapy, psychodynamic therapy. Often a blended approach of each one is used. The best treatment plan for anxiety, also known as talk therapy or psychological counseling. Psychotherapy involves working with a therapist to reduce your anxiety symptoms. Cognitive behavioral therapy is the most effective form of psychotherapy for generalized anxiety disorder. The antidepressants most widely prescribed for anxiety are SSRIs such as Prozac, Zoloft, Paxil, Lexapro, and Celexa. SSRIs have been used to treat generalized anxiety disorder, GAD, obsessive compulsive disorder, otherwise known as OCD, panic disorder, social anxiety disorder, and post-traumatic stress disorder, otherwise known as PTSD. Schizophrenia can recover significantly or even completely. NAMI estimates that as many as half of the 2 million Americans with schizophrenia can recover significantly or even completely if they get treatment. At the same time, studies show that about 20% of schizophrenia patients on medications will relapse within a year after successful treatment of an acute episode. Studies have shown that 10 years after initial diagnosis, approximately 50% of people diagnosed with schizophrenia are either noted to be completely recovered or improved to the point of being able to function independently. Recovering from anxiety is very possible with the appropriate treatment. Anxiety disorders can affect a person's ability to work, study, and participate in other activities. Recovery is possible with the appropriate treatment. Success of treatment varies, but most people with anxiety disorder can be helped with professional care. Benefits of CBT are usually seen in 12 to 16 weeks. Medication may be a short-term or long-term treatment option, depending on severity of symptoms, other medical conditions, and individual circumstances. Anxiety is not a sign of weakness. You are not wrong to be feeling it. It can feel like a bad battle sometimes, trying to get on with your day whilst coping with your anxiety. But there are people who can help, and you are not alone. People with anxiety disorders do get better, and they do get better with CBT. Recovering from depression won't be easy, but it is likely. Although the symptoms are painful and debilitating, depression is highly treatable. A combination of therapy and medication, or in some instances, deep brain stimulation treatment, is the recommended course of action. An individual is not considered cured of depression until they are symptom-free for at least 4 months. Sometimes people will have a lessening of symptoms but will return before the 4-month period is up. If this happens, it is called a relapse. Most who seek effective treatment will not go on to experience a relapse, but half who seek treatment for the first episode of depression will have a recurrence. A recurrence of depression is when someone is symptom-free for at least 4 months and then goes on to experience another depressive episode. If someone experiences 2 reoccurrences of depression, they are 80% more likely to experience another. People who experience recurrences will have an average of between 5 and 9 distinct depression episodes over the course of their lifetime. These disorders are most likely due to genetics. Lolly Whitehill has disorders that have more than likely been passed down through genetics, such as anxiety, depression, and schizophrenia. But it is also possible that Lolly symptoms are genetic, with a slight possibility of them being environmental only for depression. It's only possible for depression. Anxiety and schizophrenia can be passed down through genetics. Thank you, and that is my psychological evaluation of Lolly Whitehill.